welcome to this edition of CIBER Focus, your source for international business news. I'm Sara Reeves, and with me today is Richard Sige, manager at the National Hospital Insurance Fund based in Nairobi, Kenya. Richard, thank you for joining us today.
Thank you.
So I want to start off by learning more about the National Hospital Insurance Fund. Can you tell me about this organization?
National Hospital Insurance Fund was established through an act of parliament on the 12th of July 1967. Its mandate specifically was to cover employees, especially those who are working with government and private companies. Its key mandate was actually to collect revenue, register members, pay out claims out of NHIF, and to declare hospitals for the purposes of NHIF.
Okay.
Yeah.
Interesting. And I know that you've actually worked there for quite a long time.
Yeah.
How has the organization changed in the time that you've been there?
Over the years, NHIF has changed significantly. First of all, we started using Manila cards, and at the moment we are using what you call magnetic stripe cards. And we have actually changed our operations, say that we have connected to all our branches, and we are fully connected to all the healthcare providers accredited to NHIF.
Interesting.
Yeah.
Has this new technology really helped improve the
new
services?
technology has helped us a lot because, first of all, we have been able to eliminate what we used to call fraud incidences, because there were incidences of conspiracy, impersonation, among members who are accessing our benefits.
Wow.
Through this intervention, we are able to, actually our patients currently are able to notify online whenever they are admitted. We get to know the length of stay of our patients. We also get to know, the medical condition, because what's happened in NHIF is that when you are admitted, we are using the ICD-10 coding of diseases, which is WHO recognized, and we are able to know actually any type of medical conditions that are prevalent in a particular area. We are also able to actually advise the government in the intervention mechanisms necessary.
Interesting.
Yeah.
And you're actually an economist in your background, is that correct?
Yes.
So can you tell us a little bit about how you went from being starting your education and looking into the economics and where you are today?
Actually, I started my education in Rift Valley.
Okay.
I went through the primary, secondary school, and I was later enrolled in Kenyatta University to do my economics and business studies degree. Upon my completion, I was actually interviewed by the government, and I was seconded to the Ministry of Health and deployed to NHIF to assist to actually handle issues regarding compliance.
Okay. So
I've risen over the ranks from an inspector, a branch manager, manager in charge of registration, manager in charge of benefits, and currently I'm the manager in charge of micro insurance and sponsored programs, NHIF.
Very cool.
Yeah.
And the micro insurance is one that we're particularly interested to talk about with you today, because that's a new concept. Can you explain what the micro insurance is and how you're deploying that?
Actually, what micro insurance represents is that many Kenyans actually are engaged or employed in the informal sector. What is happening is that the members who are in the formal sector, that is the government employees, private employees, are those we categorize as in the formal. Those ones we have got no problems with them because according to the NHIF Act, they must contribute to NHIF Act. That is, it is a compulsory scheme. However, those in the informal sector is a voluntary scheme. That means whoever is willing to come on board may come on board. Now, in the process, it has not been very easy for us to attract most of the members of the public to join our scheme. And at the moment, we have a membership of 1.2 million Kenyans who have subscribed to the informal sector.
That seems like a lot.
But it's not a lot because the informal sector employs over 10.5 million Kenyans.
Oh, okay.
So it means we have not done very well. And that is why the concept of Zuri Health partnership. Because the specific need for us is that we wanted to partner with a reputable organization which can assist us to leverage on technology, because the concept of Zuri Health is actually to sell insurance to the people using the mobile phones.
Oh, okay.
In Kenya, the mobile technology is very successful.
Well, you have MPESA there, so.
Yes, we have MPESA, and it has a subscriber base of 17 million Kenyans.
That's a lot.
And through the mobile phone, we are able to subscribe. We want to encourage members, especially we are doing a pilot in Busia County.
Okay.
And we hope that the members of the public will actually be very much interested to purchase insurance specifically to cover them for outpatient purposes. In Kenya, the out-of-pocket expenditure is high because there is no form of insurance for these people. So what they normally do is that in Kenya we have what is called harambes. In other words, if Sige is sick and he is not employed, I'll call my neighbors, call my friends to raise funds for me to actually go and pay the hospital. That is not a very good thing because individually that is catastrophic spending, which is not very healthy. We thought of this idea with AMPATH, and we decided to come into a strategic partnership to see ways and means of helping these Kenyans who could otherwise have no form of insurance. What we did was that we went to the ground, interviewed the members of the public, asking them whether do they like an idea of having an insurance for them. And we found them very excited, very receptive, and they are actually waiting and telling us, when are you coming on board? Yes.
Well, that's good to see that you're getting really good response.
Yeah.
What is the key difference between this new form of insurance that you're talking about and the old form that you have so low subscribers for? Is it cheaper? Is it easier to access?
First of all, it is cheaper. Secondly, it is very convenient. Because unlike the other form of insurance that we offer currently, members of the public have to travel from far to our offices to be registered.
Okay.
We want to leverage on technology by saying that you can register at your home. If you are a vegetable vendor, you can register at your shop. If you are a farmer and you are very busy, you don't have the luxury of time to travel to our offices, you can register in your farm. And whenever you get your farm produce, we have also made it possible for you to remit your contributions to NHIF using the mobile technology.
Interesting.
Yeah.
Very interesting.
Because what's happening in Kenya today is that MPESA is everything. You are able to pay for your medical bills. You are able to pay for school fees. You are able to pay for, if you have a drink, you can also pay using that. If you are traveling, you can pay using that. You can pay your electricity bill on the same. So actually, our life in Kenya at the moment resonates around MPESA. And it has helped so many Kenyans who originally were unbanked.
Yeah. And I think a lot of our audience members might not even be familiar with this concept. So MPESA allows you to do your banking using your cell phone. It
allows you to do your banking using your mobile. Actually, it allows you to send out money. It allows you to withdraw money. It allows you to actually load your airtime to your phone. And so many other things.
And you were mentioning that people can pay their electrical bills. So having this infrastructure already in place is making this microinsurance scheme much easier to implement.
It makes it very, very, very viable. And we want to, in Kenya sometimes our roads are not so good. People travel maybe 50 kilometers and maybe it's not a tarmac road. The terrain of the area may be very rough. And transport, the fares they pay to our designated offices may be very expensive. So we want to make it convenient. The money they could have used for air transport, they use it for the premium.
Interesting.
Yeah.
And how are you able to offer the premium at a lower rate?
What is going to happen is that we have got facilities that have subscribed to AMPATH.
Okay.
There are actually over 500 units. These are dispensaries, health centers, district hospitals, and provincial hospital. And we also have a referral hospital called Moi Teaching and Referral Hospital. So what we have done is that these hospitals, through the intervention of AMPATH, they have a revolving fund for pharmacy where whenever the members of the public are admitted or they seek outpatient treatment, they are able to access drugs.
Okay.
What is happening in Kenya, which is a bit of a challenge, is that in the mainstream GOK facilities, sometimes there is out of stock. The drugs are out
Yeah.
of stock most of the time. But through the intervention of empath, most of the patients are able to access the drugs, and they have the confidence that when I go to this facility, I'll be treated. I have the proper drugs. I go home okay. Yeah,
Interesting.
yeah.
Is there anything about this insurance scheme, this new microinsurance, that I haven't asked you that you think is an important thing to share?
Yes. Actually, what is happening is that in Kenya, there are so many challenges when it comes to uptake of insurance. One, the main challenge we do have is that there is very low awareness levels in Kenya. The public information and education is quite low. People don't know. And again, there is a lot of unemployment within the country, which at the moment stands at 46%,
Wow.
which is very low. And again, there is very low purchasing power among the Kenyan people, which, for example, you can say the priority they do have, the number one priority is to provide food for their family. The number two priority is actually to get clothing for the family. The number three priority is to pay school fees for the children. Insurance is relegated to either number 4 or number 5.
Yeah.
And they do not see it as a priority. What we want to do is actually to elicit demand, make it attractive, make people see the sense of purchasing insurance, because what is happening is that whenever any member of the family is sick and they go to the hospital, the small business that the family may have been running may collapse because they need a lot of money to go and settle an hospital bill. So we want a situation whereby we want to engage Kenyans and tell them that a healthy nation is a wealthy nation. That is the whole concept of the insurance.
I like it.
Because we want them to actually pull all the resources together. We pull all the risks together so that whoever is sick among us can be taken care of. Because what we have in Kenya at the moment is that we are operating on the social solidarity principle, where those who are healthy support the sick, the young will support the elderly, and actually those who are generally, that is what we feel will help many people. And you cannot do it alone. You cannot say you are rich and you can pay your bills.
Yeah.
Together we build a strong nation, and we also anticipate a situation that we shall be very productive. This concept also is designed in such a way that the hospitals that will be participating are going to have a lot of money within their facilities.
Okay.
At the moment, what the hospitals does, because these are government facilities, is that whoever is not able to pay, the bills are being waived. Others are being exempted from paying because they are vulnerable in the society. What are the consequences? It means, therefore, that the healthcare delivery system in the country is being affected, because if someone is not paying and is being given drugs, it means the hospital at one level is not having drugs. It may be missing some of the essential consumables needed in an hospital. And in the process, they may not be able to offer quality health care to the rest of the public. And in the process, people may lose confidence that there's no need to go to the hospital, because once I'm admitted or as an outpatient, I do not get the drugs.
Yeah.
And it means people may opt to go for the non-conventional medicine.
Interesting.
In Kenya, we have herbalists. We also do have witch doctors. We also have spiritual healers.
Yeah.
And anyway, I can say they are in the same ministry of healing. Yes.
It's very interesting, though, because everything that you're mentioning that are issues that you're working to resolve in Kenya are exactly the same sort of issues that we're working to resolve here in the States right now.
Yeah.
And particularly with our new Affordable Care Act that's being implemented, we're trying to solve the underinsured and uninsured issues as well. So these are applicable around the world. I think these are things that can be useful to everyone.
Actually, health is an integral part of every citizen's life. But the main challenge we do have in our country is that because of the high poverty rate and the high dependency ratio because of the high unemployment, what is happening is that the health outcomes may not be very good in a country because people seek medical attention when they are already too sick. So we want to encourage the concept of preventive as opposed to curative healthcare. Yeah.
It's very important.
Yeah.
Well, this has been really interesting.
Yeah.
And I'm excited to hear about the new insurance scheme that you guys are offering, and hopefully you'll
Yeah.
get, you said 10 million in the informal sector, so hopefully you'll have 10 million in your subscriptions.
Yes. And our collaboration with the Kelley Business School, we hope that the MPS students will be able to give us a viable solution on how best we can actually penetrate and retain the sector. Because what we have been having at the moment is that we have people who subscribe to NHIF, majority of whom are actually sick.
Oh.
So we
The
have the
healthy
element
people.
of adverse selection.
We have
we
the
want
same
to
problem.
attract. We want to attract the healthy population to participate in insurance also. That is the main concept of why we are very much interested in getting the proper business model that will work for us and for the country. Because the whole concept of this is that upon the success of this intervention, we wish to scale it up to the rest of the country.
Yes.
Because the ultimate objective we have is that we want to have a universal healthcare within our country.
Excellent.
And that is what the Constitution says.
Oh, okay.
Our Constitution was promulgated in the year 2010. We are actually currently operating a system where we have devolved governments. We actually have 47 county governments and 1 national government. And it is the responsibility of every county government to ensure that the citizens have a form of insurance.
Interesting.
Article or Section 43 of our Constitution says that every Kenyan deserves the highest attainable health care.
Well, that's a nice thing to put in your constitution.
And, but we do not want it to remain as a dream.
Yeah.
We want to make it a reality by getting the proper interventions
Excellent.
within our Kenyan health delivery system. We also want to create a system whereby our referral system works. Because we want a situation where people use the primary healthcare facilities, what we categorize as level 1, level 2, level 3, up to level 6, so that we do not congest our facilities at the higher level. We want people to come from the lower level. If your condition cannot be managed in a dispensary, you are able to go to a health center, a sub-district, a district hospital. We do have what is called provincial, or what has been changed to county hospitals, and we have the national and teaching hospitals, which are the highest in the country.
Well, excellent.
Yeah.
Well, I think we're out of time.
Thank
I
you.
really appreciate you coming by and talking with us today.
Thank you.
Thank you, Mr.
It has been a
Sige.
pleasure,
Excellent.
and I hope to visit you again.
Yeah, well, you're always
Thank-
welcome back.
Thank you. Thank you.
That's it for this edition of CIBER Focus. If you have any comments or suggestions for future interviews, you can reach us at ciber@indiana.edu. Thanks.
Thank you.